Welcome to Burlap Teachers. Enjoy the video.
You start now by assembling the essentials and acting fast. Grab your toothbrush, fluoride toothpaste, floss, and an interdental brush. Set a 2-minute timer. Rinse briefly to loosen food, then remove any large particles with your fingers or a water rinse. Once done, position yourself under bright light and use a mirror at eye level so you can see while you work. Make sure to sit upright and protect clothing with a towel. This prevents mess and keeps focus. You now perform the core steps. Brush for 2 minutes, spending 30 seconds on each quadrant with soft, circular strokes. Angle the brush at about 45 degrees to the gum line to remove plaque effectively. Next, floss or use an interdental brush between each contact, sliding below the gum line gently to clear hidden debris. Once done, check the backs of molars and your tongue for residue. Make sure to finish with a gentle rinse to remove loosened particles. You complete the routine by applying a fluoride rinse or gel according to instructions, then refrain from eating or drinking for 30 minutes to let it work. Dry and store your tools in a ventilated case so they don't grow bacteria. Make sure to replace your toothbrush every 3 months or sooner if bristles splay. If you encounter problems, like persistent bleeding or pain, switch to a softer brush and gentler technique immediately. If the issue continues, seek professional care to avoid worsening conditions.
Thanks for watching. Consider subscribing if this video helped you.